Good, happy Tuesday evening, April 21st, 2020. I'm Riley King, and welcome to the Riley King Newscast, right here on the Riley King Network. Let's begin. First up, Sununu announces reopening task force as COVID-19 numbers continue to plateau in New Hampshire. Governor says there's no timeline yet for reopening businesses and institutions. Governor Chris Sununu said Tuesday that New Hampshire will take a phased approach to reopening after the COVID-19 crisis begins to subside. Sununu announced he was forming a task force to determine how best to reopen businesses and institutions once the danger of spreading the coronavirus lessens. He noted there is no timeline for reopening businesses and the virus is still spreading in New Hampshire communities. 44 new COVID-19 cases were reported Tuesday, said Dr. Benjamin Chan, the state epidemiologist. Tuesday was the first day in a week which no new deaths linked to the virus were reported. Chan said it appears the state is still plateauing in terms of the spread of the COVID-19. He said the number of people hospitalized has hovered around 70 and to 75 over the past 2 weeks, and there has been no sign yet of a decline. Sununu said once it becomes clear that the threat of COVID-19 is declining, the state will reopen in a phased process. He said the governor's Economic Reopening Task Force will develop guidance for different businesses and industries. This is something we're not coming out of tomorrow or even next week, Sununu said. The numbers have stabilized, and that's a great sign, but we still have ways to go. Sununu said it appears the state public health efforts have worked better than expected, but things could change. He pointed to the increasing number of cases in Massachusetts as a sign that there could still be regional spread of the illness. And now let's take a look at your COVID-19 in New Hampshire, what you need to know information. And here's a look at that COVID-19 in New Hampshire information. There are 1,491 number of people in New Hampshire have tested positive for COVID-19. 810,561 number of people in the United States who have tested positive. 42 number of deaths from COVID-19 in New Hampshire. 206 number of people who have been hospitalized with COVID-19 in New Hampshire. And 43,630 number of deaths from COVID-19 in the United States. This map of New Hampshire shows you where the cases of COVID-19 are in towns and cities of New Hampshire. In Salem, 50 plus cases of COVID-19. This chart here shows you new cases each day in New Hampshire. In the purple, daily new positive COVID-19 cases. In the orange, new hospitalizations. And in the red are the deaths. And you can also see a chart of current cases and cumulative totals. Your common symptoms: fever, lack of smell, cough, and difficult breathing. How it spreads. And prevention tips. Be sure to stay with the Riley King Network for the latest of your COVID-19 information. Live on News 9 at 5:30 p.m., get answers from state epidemiologist. Dr. Benjamin Chan answers questions about COVID-19 at 5:30 p.m. on WMUR News 9. New Hampshire health officials issue recommendation for Granite Staters to wear cloth masks when near others. New document posted on state website to offer further guidance, officials say. State health officials this week clarified recommendations that Granite Staters should wear cloth masks when going out in public near other people to help slow the spread of the coronavirus disease, COVID-19. Officials said advice is being shared because new data showed COVID-19 can spread before a person shows symptoms. A mask helps protect others around you if you are affected and don't know it. Officials say in documentation posted on the New Hampshire Department of Health and Human Services website, people should wear masks for trips to the grocery store, pharmacy, doctor office, or hospitals, officials said. Essential workers who cannot keep 6 feet of distance from others consistently are also encouraged to wear a mask. The times when people absolutely should consider wearing a cloth face mask are when they are out in public places, for example, at a grocery store, and social distancing, maintaining that at least 6 feet of safe distance is going to be difficult. That's not certainly a requirement of anybody, but we certainly recommend that people do that, Dr. Benjamin Chan, the New Hampshire state epidemiologist, said. Masks are also recommended for people who are sick in a home they share with others and for home care workers who care for vulnerable people in their homes, officials said. Chan said the mask used to protect other people and isn't designated to protect the person wearing it. It's meant to protect other people in the event that someone is going out in public and might be starting to shed virus from their respiratory tract and may not yet have symptoms given what we know about this virus, Chan said. Officials cautioned that the mask is another protection to slow the spread and shouldn't be used in places of staying home and social distancing, thorough hand washing, or other prevention measures. Health officials noted they are recommending use a cloth mask and not surgical mask for N95 masks because the specialty equipment should be revised for healthcare workers in desperate need of supplies. The mask should never be worn by children under 2 years of age, anyone who has trouble breathing, anyone who is unconscious, or anyone who can't remove the mask without assistance, officials said. For information from the CDC about making your own mask, visit www.cdc.gov/coronavirus/2019 NCOV/prevent-getting-sick/DIY-cloth coverings HTML. We will share this article with you on the Riley King Network Facebook page after this broadcast. Unemployment payments go out to tens of thousands of Granite Staters. Employment officials say state working through backlog. Let's take a listen to that video from WMUR News 9, Ray Brewer.
These are truly challenging times, but New Hampshire companies are here and open for business. Mid-state.
Over the weekend, New Hampshire doubled the capacity of its call centers to help speed up applications for unemployment and answer questions. One question many have been asking is when will they receive their stipend from the federal government? For tens of thousands, that question was answered today as the state sent out benefit payments to 51,000 people, totaling about $48 million. And for the rest,
we continue to aggressively tackle that backlog. We expect another significant payment that will be going out tonight and then through paper checks tomorrow morning.
Those checks will include the money from the Federal CARES Act.
That will include additional $600 payments for those individuals that have not yet received the $600 for some prior weeks.
Many people continue to express frustration with the system, experiencing long delays on the phone as they wait to get their questions answered. Laver says with the increased capacity at the call centers, those wait times should be decreasing.
Just yesterday, we were able to talk to 2,000 more individuals than we had previously been able to do.
He also has a hint when it comes to getting through, noting the call volume drops off in the evening.
Folks can go back later in the day, I would say, after 5 o'clock. We are open till 8 o'clock to answer those calls.
As for the overall unemployment numbers, while they continue to increase, it's at a slower pace. And Lavers is hopeful that this is a harbinger of things to come.
We continue to see those numbers coming down. We hope it is a trend. I think it's still too early to call it that.
Ray Brewer, WMUR News 9.
Okay, and there you go on that video and that report. Catholic Medical Center furloughs 13% of its workforce. CMC reduces hours of 29% of workers. Executives take pay cut, hospital says. Catholic Medical Center, one of New Hampshire's largest hospitals, is furloughing hundreds of workers as it loses millions of dollars a month because of the coronavirus pandemic. The hospital said Tuesday it will put 423 workers, or 13% of its workforce, on a 60-day furlough starting Saturday. In addition, 914 workers will have their hours reduced. Leaders at the vice president level and above are taking a 15% pay cut, and executive directors are taking a 5% pay cut, the hospital said. Like other facilities, the hospital has eliminated electric procedures and scaled back outpatient visits to prepare for a surge of COVID-19 patients. Coronavirus conserve protective equipment and protect other patients and staff. The hospital lost $11 million in March and expects to lose up to $70 million by July. Last week, the company that runs Elliott Hospital and Southern New Hampshire Medical Center announced 650 workers would be furloughed. New Hampshire fire officials urge people to not put face masks in microwave to sterilize them. Cloth masks, material parts can spark fire and break the microwave. Let's take a listen to that video from WMUR News 9.
The New
Hampshire State Fire Marshal's office has a message for anyone using a face mask. Don't put that in the microwave to sterilize it. In a Facebook post, the Fire Marshal's office posted these pictures saying microwaving masks to kill germs is a fire hazard. It's an extremely bad idea. Cloth masks overheat quickly and catch fire. Some have a metal bridge on the nose, which can cause sparks, fires, and also even break your microwave. The CDC recommends cleaning your masks with detergent in the washing machine on the warmest setting.
Okay, and there you go on that video and that report. Good information there. And now let's take a look at your U.S. stock market and see how your U.S. stock market closed for this Tuesday evening. And here's a look at that U.S. stock market. Your Dow Jones Industrial Average closed in the red and went down. Your Nasdaq closed in the red and went down. S&P 500 closed in the red and went down. Gold closed in the red and went down. Oil closed in the green and went up. U.S. 10-year closed flat. Euro/USD closed in the green and went up. And VIX closed in the green and went up. Dow falls 630 points after another oil plunge, bringing its two-day drop to over 1,200 points. U.S. stocks fell sharply once again on Tuesday as oil prices continued their unprecedented wipeout, further detonating market sentiment and dampening the global economic outlook. Trump moves to suspend immigration-aimed pandemic. Let's take a listen to that video from MSNBC News.
Kristen, let's talk about the president's suggestion on Twitter that he is going to stop immigration. First of all, is this anything imminent? Is this actually going to happen?
It doesn't appear as though it's imminent, Andrea. And talking to administration officials, they say that the details are still being hammered out. They say, yes, it's possible that this executive order could potentially be signed this week. But it's my sense that a lot of these details are still under consideration based on conversations with administration officials. Now, National Security Advisor Robert O'Brien stressing that if and when this does happen, that it would be temporary. This would be a temporary suspension on immigration. And we have to underscore this fact, Andrea, the fact that the administration has largely already stopped immigration, visa processing, all non-essential travel to the northern border has been stopped at this point, halted. And you're absolutely right. It undercuts the president's argument that the country's ready to open back up on May 1st. So all of those issues are at the forefront as the administration really tries to hammer out what could be the details of this executive order that the president says he is going to sign. Now, of course, immigration has been a signature issue for this president. It was that platform that helped him get elected in 2016. And of course, all of this does come against the backdrop of an election year. So undoubtedly, this type of language, that type of a tweet that we saw coming late last night will energize his base. But again, Andrea, I am told the details are still being hashed out at this hour.
Hey there, I'm Chris Hayes from MSNBC.
Okay, and there you go on that video and that report. And that does it for this evening edition of the Riley King Newscast, right here on the Riley King Network. Thank you for watching this Tuesday evening edition. I'll see you back here tomorrow for another newscast. I'll have a news report coming up in a little bit. Good night and bye, everyone.